During ESMO 2021, I reported the result of the Phase IIIb OReO study. The question addressed by this trial is, could we re-challenge the patients with PARP inhibitor after receiving previous PARP inhibitor therapy? In OReO, 228 patients were accrued in two cohorts, BRCA-mutated cohorts and non-BRCA-mutated cohorts, and they were randomized between olaparib and match placebo in those who achieve a response to the previous platinum-based regimen. The patients had received 3 or more lines of NA chemotherapy previously, and the prognosis was quite poor in these patients. So the primary endpoint was PFS, and OReO met its primary endpoint with a statistically significant PFS benefit for patients with real challenge with olaparib, with a hazard ratio of 0.57 in the BRCA-mutated cohort and 0.43 in the non-BRCA-mutated cohort, whatever the HRD status. The tolerance was excellent, with only 2 patients discontinued study treatment in the BRCA-mutated cohort and 1 in the non-BRCA-mutated cohort. So globally, OReO ENGOT Ov-38 opens the way for a re-challenge of a maintenance PARP inhibitor in patients who have previously been treated with a PARP inhibitor.